Okay, I want to thank everybody for joining us this afternoon. This is just a reminder that today's presentation will be recorded and posted on the Whitburn Center's website and YouTube channel. We ask that you please keep your mics on mute. We'll have time for questions and answers at the end of the presentation. My name is Lisa Lewis, and I'm the Administrative Manager in the Whitburn Center for Governance and Policy Research. Before we get started, let me tell you a little bit about the Whitburn Center. The Whitburn Center was established in the fall of 2021 through a generous donation from our founding benefactor, UWO alumni Jerry Whitburn. Our mission is to conduct nonpartisan, practical, applied research focused on elevating and improving governance, professional management, and public policy in Wisconsin and beyond. Our mission is to build local government, nonprofit, and community capacity to promote the common good. To do this work, it requires bringing people together in spaces like this one to work together to share knowledge and equip public professionals with tools and resources to better understand the dynamic topic areas surrounding Wisconsin's public sector. And now I'll turn things over to Dr. Sam Larson, who will give an overview of our Faculty Fellows Program.
Great. Thank you, Lisa. And thanks everybody for joining us today. My name is Sam Larson. I'm currently the interim director of the Whitburn Center for Governance and Policy Research. And I want to also give just a quick shout out to our founding director, Dr. Michael Ford. He's joining us today. And even though he has moved on to serve as director of the Wisconsin Institute for Citizenship and Civil Dialogue, he can't quite stay away from us, apparently. So we're happy to have Dr. Ford joining us today and all of you here in the room. I'm very excited about today's event, but I first wanted to just give everybody kind of a background on our faculty fellows that will be presenting today and a little bit more about that program. So last spring, we had put out a call and invited faculty from all over UW-Oshkosh in any school, any college, any major, to submit an application for our community engaged research fellowship program that we just launched. And really the purpose of that fellowship, we kept the scope kind of broad, but we wanted people who were interested in working out in the community, really working with like local partners, to really do what we try to do here at the Whitburn Center, which is to kind of embrace and encourage the Wisconsin idea, if you will, but to really bring our knowledge and our interests and our passions out into the community to promote better community vitality in the kind of Oshkosh region, but also, you know, learn from folks who are out in the community as well as how we can work together to, you know, be good stewards all as one in our local community. So that was kind of the general idea behind this. We had a number of applications and 2 of those applications rose to the top. And so we also thought we would be seeing individual fellows, but we actually had 2 teams of folks who you'll meet a little later who submitted and were supported by the Whitburn Center to do some community engaged research projects. Each group was provided a stipend of about $12,500 to do the work that you'll hear about today. The really cool thing about this, and this was not planned, but what we came to realize as we started to meet our teams and they were out doing this work, 2 things. One is both of them focused on really what we saw as improving language access. And so from the policy lens, I'll have a couple of students share with you a bit more about kind of language access policy and the history of that, but how these 2 groups have really contributed above and beyond. In the policy world and scholarship, we talk about policy as being what government chooses to do or not do. And so what we see today are a couple of teams who are really focusing on better serving the needs of our local community above and beyond what might be happening at the federal level historically, at least. The other amazing thing that I was really excited about with both of these projects is they brought current UW-Oshkosh students into the work that they were doing. And so we had 8 students also employed by this work over the last year or so, which has been really fantastic to see as well. So students getting kind of a great deal of experience, both in research, but also in kind of community service. So that's been a really important thing to see on our end as well. I will share, if you want, you can learn a little bit more about our program And the reports that each of these fellows have prepared, we don't have them up on our website yet, but we will in the next week or so, and we'll send those out to folks who have registered. But if you want to hear a little bit more about the program, I just threw the website in the chat there, and to learn a little bit more about our two groups of fellows. But before they get started, I want to introduce two of our student research assistants with the Whitburn Center. So we have Areli and Aspen, who will share a little bit more about language access as it's defined and the history of that policy to kind of get us founded in what we're talking about today and what these two teams have been working on. And so Areli and Aspen, I'll ask both of you to share your presentation, but also can you share with folks a little bit more about yourselves, your kind of program or major area of study before you get started on the presentation as well.
Yeah. I'm Aurelie Alvarez. I am currently a first-year student through the Masters of Public Administration program. And like I said, I'm hoping to get my master's. That's a little bit about me.
And I'm Aspen. I'm a senior political science student graduating in December of this coming year, studying political science with a minor in law and policy. And I'm also hoping to get my master's in an MPA and then also a law degree at some point in the future as well.
Aspen, can you share, I believe you have a couple of other minors that you're working on as well. Is that correct?
Yeah, so there's two certificates that I'm hoping to get if I can fit everything in that last semester. I'm hoping to get my Indigenous Studies certificate, and then I also transferred in with a lot of Spanish credits from my previous university. So I'm hoping to pursue a certificate in Spanish as well.
Fantastic. We have some high achieving students here, and Areli also works full-time up in Green Bay. And so it's been fantastic to have both of them working with us. Areli and Aspen, do you have access to share your PowerPoint, or would you like me to do that?
I should have access. Cool. Cool. So like I said, I'm Aurelie. So what is language access? So language access means providing limited English proficiency, or LEP for short, people with reasonable access to the same services as English-speaking individuals. This includes services like translating written documents, interpreting in person, over the phone, or online. Language access is important because it allows LEP people to have access to federally funded programs. An example of this is SNAP. Many LEP individuals are able to access this program because they have translated documents in various languages. This allows for more people to benefit from the program and receive financial assistance for food that they otherwise wouldn't be able to access. It also increases the effectiveness of the program because the program itself becomes more accessible to those in need. Language access is a right that everyone has. It was first introduced through Title VI of the Civil Rights Act of 1964. Title VI prohibits discrimination based on race, color, and national origins for programs receiving federal assistance. Language access falls within the national origin category because language is directly linked with where you were born. Language access was further strengthened by the Executive Order 13166 in the year 2000. This order added some more requirements. It stated that programs need to provide reasonable steps to provide meaningful access to their programs. The executive order itself was not explicit on these two terms. So to help programs become compliant with the executive order, the Department of Justice provided various documents and self-assessment tools so they could become compliant and provide language access to those receiving federal funding.
So then we get into how language access looks in Wisconsin, because obviously it's going to be different varying from state to state and especially region to region. It's particularly interesting in the Midwest. So in Wisconsin, we've made progress in implementing federal language access policies, especially in sectors like healthcare, education, and the legal system. But as always, there's always room for improvement. Healthcare systems like UW Health and Aurora offer interpretation services, but then once you get to the pharmacy level, they often fail to provide non-English prescription labels or verbal instructions. And 11% of patients are relying on family or friends to interpret those prescriptions once they actually make it out of healthcare and into using their medication and promoting a healthy lifestyle. In legal settings, Wisconsin courts provide certified interpreters, yet many police and emergency responders lack consistent access to interpretation school tools, especially in high stress or rural situations. I actually have experience working in Oshkosh Police Department, and we only had 2 Spanish-speaking officers, and they have to you have to take a week off at a time as an officer because you're working so many hours. And so sometimes it would line up and there would be weeks where we would just have no Spanish speaking officers. In which case we'd have to use a phone service, which isn't good at all. And then in K through 12 education in Milwaukee, it shows success through bilingual programs and parent-teacher interpretation services, supported by advocacy groups like Voces de la Frontera. College level and adult level ESL support is limited, leaving non-English speaking parents without adequate access to language services. And because of that, generational educational gaps between parents and children have been observed very frequently in Wisconsin. So just to pull some statistics specifically of Fox Valley, we tried to take that Wisconsin language access and really bring it local. However, unfortunately, there's a lot of limited information in our area. So in terms of statistics, total population, a lot smaller than you would see in obviously like Milwaukee or Madison, but the percentages of foreign-born residents in ratio to that population is actually significantly high. Like 3% of foreign-born residents, 5% with language diversity in Winnebago County compared to the county size is significantly large. And then we also see high amounts of numbers of refugees, with 660 tracked only by one refugee organization in Winnebago County. There's tons of other ones that don't keep numbers like this. So it's really hard to put an exact number on how many refugees there are in our community. We're also seeing a lot of, in these counties, Hmong, Congolese, Hispanic refugee groups that come in waves. There's certain waves to migration that happen that makes it hard to also track these number of refugees. And this is just a chart to kind of put that in perspective. You can see on the left that we have the total population. On the right, we have the percentage of both foreign-born residents and those with language diversity. So the orange line represents foreign-born residents in perspective to the total population, and the green line represents language diversity in retrospective to the total population. So you can see that there's a huge need for language diversity programs in our communities. However, a lot of our communities, like I said, are very rural, so it makes us hard for us to have these resources.
Mm-hmm. So I'm just going to quickly introduce the faculty fellows. So Dr. Maria Graf and Dr. Juan García Oyervides did theirs on enhancing communication between patients with low English proficiency and healthcare providers through community partnership. Their goal was to find where there's an inadequate cross-cultural communication between healthcare providers and LEP patients in the Fox Valley area. So to do this, they had 2 community partners, La Clínica, which helped find migrant workers for the study, and Reach Counseling, which helped interpret the current needs of LEP people. And how they did this is they interviewed all of their group. It was about 25 individuals, both rural and in city environments, to find where there was a gap. So what they learned is that LEP patients are receiving language access services, but it was not of the best quality. Dr. Hassan Elannani and Dr. Don Hones, their research was titled Marhaba Supporting, I'm so sorry, I can't. it moved from my screen. So their goal was to offer accessible English classes to refugees in the Oshkosh area. And they worked with the Oshkosh-Mosque to find refugees that needed English classes. So they began by giving English classes through the mosque. And at first it was just men. And then they transitioned to working with women. And now they are aiming to provide classes at refugees' homes so they can learn English.
Fantastic. Well, thank you, Aurelie and Aspen, for that incredible introduction and kind of getting us founded. And with that, I'm going to turn it over to our first team. So Maria and Juan, and I'm wondering if you're able to, if you have a presentation, if you're able to share.
Well, let me see. I have a presentation. Hello, but let me see if I can share it. Let me just looking for the share button. I don't see. Oh, share. I found it. It should be.
And while you're getting that up, Maria, I'll just let everyone else know. We're hoping to have both of the teams present, and then we'll plan to take questions and comments at the end.
Did you see my presentation?
It says that you've started screen sharing, but there it is. Yes, I can see it now.
Okay. Can now see it. Perfect. Okay, well, thank you very much. I'm just going to make a brief introduction, and then Dr. García, Oyervides, and I, we have split the presentation. So, well, my name is Maria del Carmen Graf, and I am an assistant professor at the College of Nursing. And with me, I have Dr. Juan García Oyervides, and we are going to present, and Dr. García Oyervides, who is the director of the Chicano and Latinx Studies. We are going to present our project titled Enhancing Communication Between Patients with Low English Proficiency and Healthcare Providers Through Community Partnership. So, Dr. Garcia.
Yes, thank you. Thank you, Dr. Graf. And so we're gonna go through the slides. If you can go to the next, please. So we're gonna introduce everybody to kind of like the work that we did, and this series of slides is also kind of like a summary or assembly of the report that we have presented. So a lot of this information is going to sound familiar for those of you who have the opportunity to read it later on. So uh, in this project, right? So we approach this project from the perspective that there has already been some work done, right, in the realm of language access, and we're focusing specifically on healthcare, right? So there's a couple of reports that signal not only what Areli and Aspen were already presenting, right, the need. The basis for how language access should work and how it should apply in the medical realm and the healthcare area, but also the fact that this is a trend that is growing and a need that is going to continue to exist in the state, as they also mentioned, right? It is not only impactful or not necessarily impactful because of the number of people that would be impacted relative to the overall population of the state, but rather for the ways in which it would impact people's ability to access something as important as healthcare, right? And so one of the particular, not necessarily findings, but one of the particular findings that these two reports are introducing to something that is informing also the research that we're doing, right, is the need to be not only bilingual, not only to provide language access on the surface level, right, which is to translate or offer renderings in the languages of the EL that are known to the LEP individuals, right, but also to further increase that knowledge by either the agency or the individuals who are performing the interpretation, right, to include awareness of the beliefs and values that come and that show through those languages, right? Dr. Graf, if you can go to the next one, please. So these are some of the recommendations from those reports, right? Organized and kind of like developed through the state, right? The need to increase recruitment in bilingual and bicultural providers, to support community health workers, like promotores de salud, right? Not necessarily only medical providers, but also people who promote access, right? And facilitate access through those services that already exist. And as the presenters were saying earlier, the need for more data for us to it's an important motivation for us to continue to do this work, because in order for us to develop policy that is more effective, we need to have certainty of who is what is it that we need and who is going to be impacted by this, right? And one of the other things that we found in this work that has already been done, right, is that there is already a recognition that there needs to be something in the ways of a language access plan, right? Some form of policy that addresses, organizes, and supports the work for language access, specifically in the state of Wisconsin when it comes to healthcare and health services. So I mean, these are data that Arely and Aspen already kind of introduced, but just for clarity, over 100,000 multilingual residents may need language access by 2024, right? This is in the state of Wisconsin. Interpreter training is limited. This is also something that we found in our research, right? The fact that while a lot of colleges have classes that are related to this particular capacity, which is interpretation training, there are only 6 of them who have dedicated faculty that are able to teach at least one class that is original to that class, to that institution, and this is in the public system, right? And there are no state level certification laws beyond the federal standards when it comes to medical interpretation. And I think
And then I'm just going to take over now to explain a little bit more about how we conduct our study. Thank you, Dr. Garcia. So our study focused on improving language access for Latinos in Wisconsin, well, Hispanics in Wisconsin. However, our participants came specifically from Outagamie, Fond du Lac, and Winnebago counties. The data from the interviews indicated that there were significant gaps in availability, usability, and trust in the current systems that offer these type of interpretations in the medical context. We use a community-based research approach, conducting 24 interviews with Latino individuals in the Fox Valley and surrounding areas, rural areas, during the summer and the fall of 2024. Our team partnered with local organizations for recruitment, but also for the validation of our findings, since these agencies are the ones who work more closely with this community, with these participants. All our interviews were conducted in Spanish, and they focus on exploring the experience of the participants with medical interpretation. We have collaboration between UW-Oshkosh with Rich Counseling and also with La Clinica. La Clinica help us to identify these participants from rural areas, and Rich Counseling as well, more like in the urban setting, but they help us with the validation of our findings. We form a multidisciplinary team, and Dr. García Oyervides from the Chicano and Latinx Society, and like I who work from the College of Nursing. But we also have 6 bilingual undergraduate students in our team, and they are Geraldine Frias Cuevas, Carla León, Mia Hernandez, Leslie Patiño, Ashley Patiño, and Ava Summers. So they work with us and gave us a great opportunity for mentorship and collaboration. So this is a figure that I created to illustrate the findings, our key themes, and this is preliminary data findings. We use a thematic analysis approach where we were like doing line by line review of the transcribed interviews, and then from that data emerged the following themes: insufficient interpretive competency, interpreter shortage and accessibility, and lack of clarity around interpretive services. And now I'm going to explain these things. So the first one, insufficient interpretive competency. Many participants reported that interpreters lack knowledge of medical terminology, both in English and in Spanish, which led to misunderstanding about diagnosis and also about treatment. For instance, one of our participants said, when I was pregnant with my son, I developed prediabetes. So she was seeing the provider, and the provider advised the type of food and nutrition that they needed. And the participant said, the interpreter just said a snack, right? But didn't explain what kind of a snack. I don't think she spoke English 100% well. So another participant said, there were interpreters who understood you, so just referring to herself, 100%, and some who just did not. Finally, they are not using the correct terminology. Some interpreters don't express well in Spanish. Some are good, while others are not very convincing. So this demonstrates that the participants acknowledged that some interpreters were helpful. However, others created more confusion, which reduced the patient trust in the healthcare system, right? Like in the services that they receive from our healthcare system. The second thing was interpreter shortage and accessibility. There is a widespread shortage of qualified interpreters, and I just want to make highlight here the importance of the word qualified interpreters, right? Like we may have, participants may have family members or friends who help them with interpretive services, but that doesn't mean that they are qualified to the context of the healthcare especially. And this is observed especially in rural areas. So because of this, because of the lack of availability of interpreters, our participants experience appointment delays or cancellations because they didn't have an interpreter available. One of the participants said, I was the last patient to see the doctor. So even though the participant came at the right time, their services were delayed because, like she said, I was waiting for the interpreter. Another participant said, I called to book an interpreter, but the agency didn't answer. They don't even return the call because they are too busy. And this reflects that this is this happens many times, to the point that now the participants, the patients know that if they don't receive a call back or the agencies don't answer their calls, it's because they are overworked, they are too busy. Finally, one of the participants said, when we call and need an interpreter, it takes a while for someone to answer the call. You know, it is a bit tedious. So even remote services were overburdened with long wait times and unreturned calls, which also leads to the distrust in the services that we are offering. The final theme is lack of clarity around interpretive services. Many patients didn't understand how to use interpretation services, or they didn't feel empowered to ask for clarification while they were receiving these services. Some didn't even know they had the right to an interpreter and felt that services were denied or could have been potentially denied because of the need for interpretation. For example, I understood some words the doctor said, but the interpreter didn't relay them. I didn't ask for clarification because I didn't want to cause problems, like in fear of retaliation, right? The other participant said they didn't want to see me because my appointment lasts more than 30 minutes. Why? Because when there is a need of interpretation, the process will take longer as there is a need for the interpreter to convey the information from the provider to the patient in Spanish and from the patient to the provider in English. So the providers know that those appointments are longer than the regular ones or the ones that don't need this type of services. Finally, one of the patients said, having that interpreter was my only option, that specific interpreter. I didn't know how to advocate for myself. So the services that they received were not good. The experience was not good. However, it was the only option that this patient had. And in order to avoid losing that only option, that only way how to communicate, they didn't make a complaint because they felt that they didn't know if they had the right to do that. And once again, they fear for retaliation. So they were unable to advocate for themselves. So this confusion in the rights and the processes for these services led to discomfort and also to the underuse of the services that are available. So just to avoid these uncomfortable situations, the patients use family members instead of the interpreters. So our conclusions show that there is a clear systemic gap with under-trained interpreters, with poor access and lack of patient awareness about the services and about the rights. The gaps in interpreter training lead to mistrust, but also to miscommunication. The shortages led to reliance on untrained family members. The patients lack awareness of the rights and what services are available. And this is more evident in rural areas. These issues create an increased risk for misdiagnosis and reduced quality of care for patients with low English proficiency. Our current system often forces patients to rely on family or to forego interpretation altogether. What are our recommendations? Well, certification, statewide certification standards, developing a statewide certification for medical interpreters, also enhance interpreter training, expanding training in medical terminology, both in English and in Spanish, and also in cultural mediation, and to create clear patient guidelines, right? Create clear multilingual materials about interpretation rights and processes, which should be distributed in clinics and also in the community. So what is our next journey? So we are actually developing a certification program for medical interpretation and cultural mediators. And in addition, we are committed to elevating our online education by integrating cutting-edge technology through an innovative VR tool that will empower the students to immerse themselves in practical scenarios, effectively bridging the gap between theory and real-world application. So thanks to the Whitburn Center, we were able to collect this rich data that led us to apply for other grants that will help us, move this certificate program further and with the use of technology. This initiative enhances learning and also equips our students with the skills that are essential for them to be successful in the field and prevent patients from undergoing these negative experiences. So that's all what I have right now for you.
All right. Thank you so much, Dr. Graf and Dr. Garcia Oyervides. I have so many things to say and so many questions, but I want to just give as much time as we can to our other group. These are just such fantastic projects. So I'll hand things over to Dr. Elannani and Dr. Hones to share with us the highlights of their project.
All right. Hassan, would you like to say a little bit about as the representative of the community partner and of the university partner, so you are involved with both, would you like to say a little bit about how we brought this together?
Dr. Hassan, you are mute.
Thank you. Thank you. Yeah. So, yeah, first of all, thank you, Dr. Larson. Thank you, Lisa, for your leadership in this project. And thanks to all who are attending. Yes, Dr. Holmes approached me about this idea of, developing a partnership between the mosque and the university to support the new refugees, the newcomer refugees, understand a little bit, learn a little bit of English and also understand some skills that are necessary for their settlement in this area. And after a lot of long discussions and also visits by Dr. Holmes to the mosque, and we deliberated a lot, and then we said, okay, this is a great idea to start with. And then when the call for the proposals came from the Whitburn Center, Dr. Holmes proposed that we develop a proposal, and we got it. So that started this partnership that we're going to present today.
Thank you, Hassan. And you know what, I'll carry on for a little bit longer. We'll go back and forth if that's all right. I just wanted to say, first of all, can you see my screen? All right, thank you. Yeah, so we had a few questions that we wanted to look at with this research. One was to look at what would be the impact, how would offering these classes with the mosque, offering them, and as we began with offering them in the summer at the mosque, impact pre-service teacher perspectives on diverse learners and community. How would it impact adult refugee and immigrant learners in their English language development, as well as their views of the university and the larger community? And three, how would it support UW-Oshkosh in its efforts to engage and develop relationships with diverse members of the larger community? So kind of three related questions there that we began with. Just a little bit about the research behind it. We've got to acknowledge, as I know with the wonderful project that Maria and Juan are working on, we're living in this moment. It sometimes seems like a very long moment of anti-immigrant messaging in media and government and things like that, which makes it really complicated for any of the members of our community who are non-native English speakers, who are refugees, who are immigrants. We also can say that, as was shared in some of the data earlier, Oshkosh has become a center for refugee replacement for immigrants to come to in Winnebago County. And again, we're not Milwaukee, we're not Chicago, but for Oshkosh, it's kind of a transformative thing in terms of who's living in our community now. And we don't have to go very far. I mean, here at UW-Oshkosh, we just have to walk across the street. And the community is right literally at our neighbors, people who are coming from refugee and immigrant backgrounds. One thing that I looked at as I was thinking about this, and one thing that Hassan and I talked a lot about, was the fact too that oftentimes the refugee resettlement agencies usually, and they're great resettlement agencies that take nothing away from their work, but typically related to different Christian organizations. There's just a very few places where where these kinds of processes have been recognized in terms of resettlement through a mosque. There's one or two examples in the country. A lot of the services are offered in outside places. And by the way, while we're talking about services, one of the great places here in Oshkosh is the Winnebago Literacy Council. And I want to give a shout out to my colleague from there who is here today, Rosie Booser, who has done such a wonderful job, both with the families and the children of the immigrants and refugees in this community for many, many years. Again, there's a little bit of data about what has been done in other places in terms of agencies and organizations that have worked through mosques. And this kind of informs Hassan and I as we look through this. We have different kinds of data collection that I'll let you read that on your own. I want to get into a little bit about what we actually found out. We did use narrative inquiry, by the way, as our way of thinking about how we want to organize the research. In the summer, we offered some classes at the mosque. Hassan sent out I think I have it. I might have it in here. I hope I added it. If I didn't, I will add it before too many days go by. He sent out a flyer that was made available at the mosque, advertising these classes in English and in Arabic. And we started, as he mentioned, with some, as has been mentioned, with some male participants, and we developed also a women's group, 2 different classrooms at the mosque that ran last year in July and August. And we had 2 instructors who were students working with us on these as interns. And I would like to, if they have a moment, just to introduce themselves really quick. We had Nick working with us, Nick Hindle, as well as Olivia Holland. If you each wouldn't mind saying hello real quick or just checking in. If you're still there. I saw you earlier. Hey, Nick.
Hi, I'm Nick. I'm currently a sophomore at UWO, of course. I'm going for secondary education, social sciences with a minor in history. And then I'm also in the honors college, and I'm in a lot of other groups. I had Dr. Hones is my education truths and myths teacher. And so that's how I knew him. And that's when I joined over the summer with this program that they created, and it was truly life-changing to hear the stories from the participants and just seeing them grow in their language abilities and hearing their stories. Yeah.
Thank you so much, Nick. Yeah, and thanks for sharing that. I having the conversations with Nick and all of us together, the 4 of us together, it was so great to hear how this was impacting both him and Olivia as students and also teachers who were participating in teaching and learning and learning about culture and all at the same time. Olivia, I don't know if you have a moment to check in. I do have a
Yeah.
quote from Olivia here as well. Go ahead.
Hi, can you hear me, first of all?
Yes.
Okay, perfect. Well, my name's Olivia Holland, and I am a senior this year at UWO, currently in my student teaching ESL placement, actually. And let's see, my major is Spanish and Education, K through 12, with a minor in ESL and certificate in bilingual education. And I got to know Don through many of my ESL and education classes. I first started volunteering at Fox Valley Tech in Oshkosh to help with ESL on Friday mornings, and then that offer was extended to help out over the summer, leading the women's classes at the mosque. And I would agree with what Nick said. He, mentioned how valuable and eye-opening of an experience it is, and I 100% agree. As much as I thought I'd be helping them, they also taught me so much about their culture and religion and just their stories of how they came to America and why they're here. And that was really valuable for me.
Thank you so much, Olivia. Glad you could join us over your lunch break. Yeah, and it was such a pleasure working with both of you. And I did want to share one thing that happened, and I changed the names of some of the people, participants at the mosque, just to because this is still at the research stage. But Nick and I were invited to come to Friday prayer by two of the people we were working with, and I just needed to share what a wonderful experience that was, I think, for both of us. And just given a sense of what it's like to be with a community, that feeling of community was so strong. To literally the way that I was raised as Catholic, right? So I know it's like to be in a pew with my whole family and all that, and there would be certain people would sit in certain places, but to go into a place where everybody's standing shoulder to shoulder, where there's no assigned place. You come and you're there with the community. And I just felt it's just a real strong sense of equality, solidarity, brotherhood. And these were people from all over. And it was really a cool experience just to experience that, a brief time at the mosque that I can say that as a professor who is interested in a lot of, I guess I would say, cross-cultural kinds of things. Yet for me, that was especially impactful, and I definitely would like to, again, as Hassan and I talked about how we connect the university with the mosque community. I can say from my perspective, and I'm so glad that Olivia and Nick could share coming from the perspective of the university, it was very enriching. And Hassan, I wanted to turn it back over to you for a moment because you, as someone who is so integrated into the mosque and as someone who knows the community so well, are there things that you want to share that from the perspective of the mosque, how has this project been going? Any kinds of additional things that you want to share, and from that perspective of the community partner?
Yes, thank you very much. Thank you, Don. Thank you, Nick and Olivia. First of all, I forgot to introduce myself. I teach in the Department of Leadership, Educational Leadership, Foundation Literacy here at the College of Education, same college where Dr. Holmes teaches in the Department of Teaching and Learning. When I advertised for the program or the project at the mosque, there was a lot of interest. People were interested in learning English, especially by native speakers. They thought that the best way to learn a language is from American native speakers, especially they are coming from the university. There were some obstacles for those who are interested, especially male participants, is their work shifts. They have very weird work shifts. They work in factories in the area and also in grocery stores where they have to work the night shift. So it was a big challenge to find a common time and common schedule for them to come to the mosque. So there's a lot of interest, but there were so many obstacles. And one of the interesting aspects of the program is not just teaching them the language, but also teaching them or giving them information and making them aware of the opportunities that are available. For example, they want to know what is the process of buying a house in Oshkosh. How do we get, for example, to learn get certificate or learn a skill? How can we navigate law enforcement? How to understand the rules and the laws? Because these are families coming from traumatic situations, mainly from Afghanistan, from Syria, Iraq, from Angola. So they have been through a lot, and they were displaced. Some of them were displaced 2-3 times before coming here. So there's a lot of trauma. There are a lot of challenges. Putting their kids in schools, earning decent income, paying the rent, paying the utilities. After World Relief and our organizations, they did their job, settling them. But after a few months or 1 year, they have to provide for themselves. So there are a lot of challenges, and on the top of this is to learn the language. So I think the project was very well received, but there were a lot of challenges. That's why the idea of hosting the teachers, the instructors at home, at their homes, was a very good option, a very good alternative, because it will be based on their schedules, on the work schedules, and also it will benefit them, especially the whole family, interacting with the native speakers of English who are our students at the university. So, and this is really a good step towards more collaboration, more partnership, so we can also maybe look at other areas where they can benefit from the expertise we have at the university, like Dr. Graf mentioned, especially services, other services like health services and social services in the area that can benefit them.
Thank you. Yeah, I just wanted to mention too that we have grown. We didn't limit participation just to members of the mosque community, but both in the summer and then now as we're doing some home connections, we opened it up to a broader immigrant and refugee community. And everybody's got their story, right? I did want to include just a couple of excerpts from two of our current. These were not our interns of last summer, but two students who have volunteered to work with some of the families and go to their homes. And just a few comments they made about a person I'm calling Beatrice, who is from Haiti and is here with her daughter. And just some of the impressions they had, both of how a little bit about her life, but a little bit about her goals, but also about the many, many, many challenges that people who are in our community are facing, whether they have official refugee status, whether they have temporary status, whether they have residency. Everything is, so much is being questioned right now, unfortunately, and there's so much uncertainty within the communities, and our students are learning about that as well, and trying to think about how to make connections with that in their own work as teachers. And then just some findings that we had. I don't want to keep going too long because I know we're short on time, but a few among the things that we looked at were again, trying to have these language classes in a way that's convenient, that's desirable, whether it be at the mosque, whether it be in people's homes, and as Hassan mentioned, work schedules and a variety of life events are always things that make it complicated, but we've had a really good reception at the university as well for doing this amongst students. And so I'm hoping this is just a growing process and we will continue with it. And I will stop there. Thank you.
Fantastic. Well, thank you, Hassan and Dawn as well. And I think we do have a little bit of time left. I just want a quick comment and then would be happy if folks have questions, you can raise your hand or type it in the chat. But I just want to reiterate just how thrilled I am with these projects and, essentially at this time to just so important. A few things that both of the teams mentioned, but I just see this as, projects that are such great opportunities. It just doesn't even seem like it hits what this experience has been for students. So Olivia and Nick, it's great to see you and meet you, and I'm so thrilled. And I know that the other folks, I think Leslie and Ashley and other folks on the team with Juan and Maria, and there may be some others too that I missed, but I was seeing you here as well. And so I just want to thank each of our faculty teams for creating this opportunity and doing this very important work and bringing students into this. Maria mentioned, that this is really bridging theory and real world application, and what a phenomenal example of that. But with that, I will open it up to questions or comments from our guests, if anyone would like to raise their hand.
I'll ask
I see.
one.
Oh, go ahead, Elizabeth. Hi, welcome.
Hi. Thank you, everybody, for the presentations. Really informative, and I appreciate all of the work you're doing. I guess one of the things I'm always interested in when we're involving students, which I think is so important, is some of the obstacles and how you navigated that to turn it into a positive that you may have experienced with, supporting these students in their learning too, and involving them in the process. Maybe there weren't any obstacles. That would be great. That hasn't been my experience, but
We had, oh, go ahead, please, Juan.
No, go ahead, Don. I
You
have
had one.
something to say, but I also okay. Yeah, so in our case, the biggest constraint with getting students involved wasn't necessarily motivation, but really lack of time, right? Lack of time from from faculty, of course, because everybody's busy all the time, but mostly from students, because one thing that I mean, I've only been here at UWO for this is only my second year, but in through those 2 years, I have had really good opportunities to work with students throughout every semester, and it is always the same challenge that students bring about. That is, they're busy working and then doing the schoolwork, right? And so that leaves very little time for, and I can be more specific than this. That leaves very little time uh, for a job that is only temporary, right? The job that is only going to be like, for example, I don't know how Don and Hassan you organize this, but we were only able to offer 5 hours of paid work per week. That's how we made it right through the period, and for a student to, let's say, leave a 20 hours per week job to do 5 hours per week is just doesn't make financial sense. So again, not to say that money is the problem, although it is of course very important, but it is, I would say, time is the most yeah, it's the most expensive resource that we have right now.
I just wanted to add just real quick that I wanted to pose that question to Nick or Olivia in just a moment, but I just wanted to say, since we started trying to organize the home visits, I think with that, it's there's always just that uncertainty of are you on the same page of what time this was going to be? I mean, between the home and the individual coming out to visit, what's going on in people's lives that might. One of the groups, they said, "Oh yeah, the woman we've been working with, she just had a baby. She has a baby now, which is exciting, but she's probably going to be taking a little break, for a while for some very good reasons." And so, just life events, as Hassan had mentioned earlier, even the changing work requirements and hours and shifts that people have to is challenging. But I want to ask Olivia or Nick if you wanted to add anything, any particular challenges you found as students working with this.
Yeah, I would say from the teacher perspective, I think one of the most, like the biggest difficulties is just dealing with multiple levels in the classroom, because I was the only teacher. We might have, 5, 8 students or whatever, and some are at a higher level of English and some are at like a very newcomer beginner level. So I know that even then, like the class, if it were up to me, I'd have probably more than one teacher in there, split them into groups more based on their levels. But with what I could do, I tried to find activities that I could scaffold and like have like just fit them to basically their needs, so that the 1 or 2 students who are at a lower level didn't feel singled out. Because that's what I was noticing, that it's very nerve-wracking, like in with a group of people, with a native speaker who knows obviously way more than you. I think it was a little intimidating at times. So yeah, basically coming up with less pressure activities to engage them and make them feel welcome before like trying to have them pronounce really difficult words and things like that.
Go ahead, Maria.
So I just want to add that, like, something that was difficult for me, and I'm coming from like the health sciences / mental health / my Chicana feminist background, is that supporting our students through this process and helping them understand the participants from cultural humility and understanding the power imbalances that exist. In our case, we have what is called racial concordance, meaning that we are all Latinos, Hispanics, who are working with Latino Hispanic participants, right? So our realities intersect, like in various points. However, we cannot ignore that there are, like position of power and privilege. And we have to help our students navigate that, understand that we shouldn't only look at the weaknesses of our participants, but we have to focus on the strengths that they have. Like in one of Don and Hassan presentations, one of the students talked about the strength of these immigrants who came from a completely different culture, right, to America, right? So I think we need to focus on those strengths. And from the healthcare perspective, we like to look at what our patients bring to the table so we can build upon that, which makes our work more efficient versus trying to start from scratch. Like you start from +5 versus -5, right? How this sense of community, right? So if that is a strength, if that is something positive, we should start working on that and focusing on that.
Fantastic. Yeah, and I just saw Elizabeth put in the chat an asset-based perspective rather than a deficit-based perspective. Well, I love ending this conversation on that note. And so I think I'd want to continue, but we're just a little past time. So I just want to thank again our fellows, all of the students that came together today, that contributed to both of these projects, and Aurelie and Aspen for kind of kicking things off with us on this. And I'll hand it over to Lisa to end us this afternoon.
Well, thank you to everyone for coming. If you have any further questions, you can email us at the Whitburn Center at uwosh.edu. And we invite you to join us for a virtual event on April 30th at noon titled Let's Talk, an innovative program in Marathon County. And the basis of this event is the Wisconsin Institute for Public Policy and Service recently released a report from a series of dialogues on the topic of immigration. The discussions were part of Let's Talk Marathon County, an initiative aimed at fostering constructive conversation among residents from across the political spectrum on a variety of public issues. Additional information about this event can be found on our website. And then lastly, in May, we will be having a Whitburn Wednesday event titled How UW Students Are Building Their Civic Muscles from Bridging the Divide to the Pluralist Lab. And we are still getting the date and time finalized, but we will send out more details closer to the date. So thank you to everyone for joining us, and enjoy the rest of your day.